Hi everyone, my name is Heather. I am a registered nurse and health consultant. Today I'm going to be bringing to you a training on cross-contamination and gloving, something that I do love talking about and something that I actually have to talk about often because even though we are trained on these things and we do them every single day, there's always room for improvement, I feel. So there was a lot of, when I was doing my observations, I felt like there was a lot of struggle in this area. So that's why I really wanted to bring extra attention to it. And I always feel it's good to refresh on this anyway. It's a topic that really does a lot of good for our centers. So I'm just going to play this. Okay, gloving, what childcare centers should know. So I'm going to take you through this. We are going to learn basically how to improve our best practice when it comes to decreasing cross contamination. I think the best way to do that is to understand it. And I made a visual tool, a little video that I hope is going to help. We want to increase our knowledge on common classroom illnesses. I think that will help us kind of have a better understanding and a better goal to decrease those illnesses. And then also linking those into the Head Start standards of safety practices. So looking at those ways to prevent and control infectious diseases, appropriate toileting, hand washing, and diapering procedures, safe food preparation, and even exposure to blood and bodily fluids. Like, how can we handle that better? So wherever we are now, we want to, moving forwards, look at ways that we can improve. And I think even if we're able to improve, a certain amount, we are doing good, right? Or at least train our brains to think differently. So education does that for us. And so I have this cute little girl here. She's saying, do gloves replace hand hygiene? And the answer to that question is no, it doesn't. So a couple things when it comes to facts about gloves. They can create that false sense of security that our hands are clean. And what I mean by that is, and I just want you to kind of think, because I feel like once I start talking about this, you're going to see it more often. And I was just talking the other day about just say going to Stop and Shop or going to your local grocery store. For me, it's Stop and Shop. And you see how people they put on their gloves, they walk into the store, they're touching everything, they're touching their phones, they're touching their face. They put all their groceries away, then they touch their door handle on their car, and then they get into their car, they touch their steering wheel, then maybe they take their gloves off, maybe they don't, who knows. But all that good, like, yes, you protected your hands, great, but you did not protect spreading germs or cross contamination. So that's what it's really there for. It's to protect you, yes, from getting it into your body, but the other piece of that is you don't want to then spread germs to other people to get other people sick, or of course, essentially you're going to get sick as well. So keep that in mind. You're going to see that more often. And I think that's interesting because you can apply that into your classroom as well. So whatever you're touching after you do a diaper change, help a child with toileting, even setting up meals, blowing noses, things like that, be aware that yes, your hands are protected, but you could still cross contaminate. So hands can also get contaminated while wearing and removing gloves. So think about that. If we don't wash our hands before we touch the gloves or pull them out of the container, whatever we had on our hands is now on those gloves. So in addition to that, there could be holes in the gloves. They're not foolproof. And they could even get a hole as you're putting them on with your jewelry. A lot of us wear, wedding rings and things like that. Or when you're taking them off, things that were on the gloves, the bodily fluids can splash onto our bodies. So just keep that in mind. And then gloves also spread germs just like bare hands. So just like I was talking about, just because our hands are protected does not mean we can't spread germs from object to object or to ourselves, person to person. So washing your hands before and after using the gloves are incredibly important. And that's the reason why. You will decrease the amount of potentially deadly germs simply by washing your hands before and after. So where do most cross-contamination, where does that occur? So we're looking mainly at where I saw it, and actually for 9 years of being in early childhood, diapering and toileting, meal times, runny noses, drool, are those are the main, we live in that. That is our lives. Like that's what's happening all day. So how can we handle it better, and how can we manage that so that this way we're not getting ourselves sick, our children aren't getting sick, their families aren't getting sick. So it is a vicious cycle that is preventable for the most part, with good hygiene. So I made a video to try to demonstrate how we cross contaminate, and I'm going to play that for you now. Hey everyone, I am going to do my best to try to demonstrate cross-contamination in the classroom. So right now I have my clean gloves, and I just want to talk a little bit about washing your hands before putting on your clean gloves. Because as you can see, as I pull out the gloves, I am touching my clean gloves. So they're definitely not as clean as they should be. I could have very easily have grabbed a toy that was in a child's mouth, not knowing it. Obviously, there are lots of things that happen in a classroom that we're not paying attention to. I could have touched my face or, anything, and now that is on this glove. So a great idea to wash your hands, or at least if you can't get to a sink, to use hand sanitizer. So I am putting on my nice clean gloves, and we are going to pretend, let's just say that I just cleaned a child's diaper, okay? So this hand, I cleaned my child's diaper, and now I have some bodily fluid on my hand. Okay, so now I need more wipes, and I grab the wipe container or pick up the caddy, and here we go. And then I put that down, and then I need to open a drawer because that's where the diaper bin is, or lift up a lid. Whatever I touch, this is going to be there. So keep that in mind, that is how germs are spread. I could touch my face, not even knowing it. I can get myself very sick. So now that I have the contaminants on my hand, I need to be very careful about taking this glove off. And this is another reason why we have to wash our hands. I mean, obviously we wash our hands after anyway, we all know that, but this is why I'm pulling this off. There is a very good chance that whatever is on this glove can get on me. So I want to be very careful taking that off, putting that in my hand, slipping my hand up and pulling it over, and then just discarding that in the trash. Now, any of that could have splashed onto my wrist, onto my hands. There could have been a hole in the glove. Anything could have happened. So I'm going to wash my hands for 20 seconds before touching anything, or at the very least, if I'm outside, use some hand sanitizer. I hope that clarified some questions. If not, please feel free to reach out. So that was a visual of basically what's happening when you are, like, let's say at your diaper changing table. But I mean, you can pretty much take that demonstration anywhere with meal times, and also with blowing noses and drool and things like that. So when we're talking about specifically diaper changing, think about when you get prepared and get ready for diaper changing. Like, you should get everything you need ahead of time, because your table is sanitized. You have your child on there, you open the diaper. You want everything there, because anything you grab with that glove after you open that diaper your glove is now dirty. So then you go, if you touch the wipes, if you touch, get the medicine, like diaper rash creams and things like that, those are now contaminated. So someone may grab those things without putting gloves on. And even if they did put gloves on and they went to go touch another child, you're definitely spreading germs in a very high risk area. So if you do need more wipes or things like that, you need to take off that glove and get the wipes. And the thing is, you don't know who touched that before with dirty gloves. So it's like a whole thing. You have to really be careful. I know that there's those caddies that centers like to use, where it just, has everything in there, and you bring it up and you put it on the diaper changing table, and then you take it with your dirty glove afterwards and you put it back underneath. Again, someone's going to grab that. That's going to be spread. This is how we spread things from child to child and teacher to teacher. So I just want you to keep that in mind. and kind of think about that as you're going through these things. And we're going to talk about that more as we move forward because we're going to be taking a closer look right now. Let's see if I can get this to change. Okay. I have to keep moving my face over here. Okay, so fecal oral transmission. I just decided to pull a few of some illnesses that we have in our classrooms that are common in early childhood. These are the common ones. So I just put a little blurb about each one. I'm not going to read them all, but just for a couple examples, I mean, the adenovirus, there's different strains of that. It's a range of viruses that cause cold, flu-like symptoms. We also have the bacterial ones like the Campylobacter. Say these so poorly, but that's a bacterial illness that causes diarrhea. It's foodborne, but think about it. You know, children will get it. It's a foodborne illness, but they're spreading it person to person through the fecal oral transmission. Coxsackie, I mean, we all have that. We know it spreads like wildfire. Why is it spreading? Because children are touching their mouths. It's from the diaper changing table to touching objects, which then those objects, kids are touching them and putting them in their mouths. It's those kinds of things. Are we sanitizing? Are we disinfecting? Are we doing what we're supposed to be doing to keep the environment clean, and like cutting it off at its source? So the enteroviruses, those are upper respiratory fever and rash. Like we see these things all the time. So, as you go through, you can read up on and read them on your own, but they're all very similar in the sense that the way that we stop them is from just the good hand hygiene, the proper glove wearing, and then cleaning and sanitizing. So just environmental health is so important. Best practice is so important. I wanted to bring attention to this slide, and I pulled two of the illnesses out, the adenovirus and the Coxsackie. But what I really want to bring attention to also is the American Academy of Pediatrics website. So I linked that in the resources and the reference pages all the way at the end of this, because I feel like it is such a good resource, right? So we can pull any virus and we can learn so much about it. So a lot of us have illness letters that we send home to our parents, but there are some things that come up that we just don't have an illness letter for. So this is a great research for our own personal information and to also use this to send information home. Now, the information on this site is also in Spanish, which is something that I look for in every site, because we want everyone to have that same information, not just, parents who speak English. We want to make sure that everyone has access to this. And it will tell you, a little bit of information about the disease, but also how it's spread, how to stop it, how to, what we're really looking for. And for Coxsackie, I thought it was really interesting because I did not know that it also causes muscle infections with certain strands of it, and then also nervous system infections like meningitis. Like I had no idea about that, so I learned something new as well. But it's good to know about these things, especially since Coxsackie is something that we all have. We should know everything about it. So just a great resource. I love it. I'm on it all the time. And I think that, just something to look at. Here's another one that I pulled from the American Academy of Pediatrics. That's the cytomegalovirus. It said something like almost everyone has this at some point in their life, but it's a common virus it's a herpes virus, which I thought was interesting, but this one spread through like saliva, tears, urine, blood, and even breast milk. What do we have in the classroom all the time is, children are always they're crying, they're drooling. We have, the runny noses, like these things happen. So, this is how it's spreading that way. So if you go and you blow a child's nose with a tissue, and you just throw that tissue in the trash, you don't do hand hygiene afterwards, it is very easy that or increases the chances of you spreading this type of illness very easily. Or even if you use the glove and you put the tissue, you glove your hand, wipe the child's nose, put the tissue in the glove, you should still wash your hands or do a hand sanitizer after that. That is best practice. to decrease the chances of anyone getting these sort of things or it spreading. So we have the American Journal of Nursing. This is a study. And I always love a good statistic because I feel like it really helps us understand the bigger picture. So, yes, you have a whole bunch of children in your classroom. These diseases are happening. No one can say that they have a disease free classroom. So, we know it's happening. We know we're a part of this. So, just a kind of understanding childcare providers and parents may clean their hands properly only 22% of the time. And this is I believe this statistic because I've seen it. There is no way we're washing our hands for 20 seconds every single time. And I remember even in nursing school, the first thing that they made us do was we had our instructor walk us all into the ladies' bathroom, men as well, and we all had to get signed off on washing our hands. Then on top of that, I believe when I started Hartford Healthcare as a nurse, that was the first thing that they made me do. My preceptor made me walk in and wash my hands. So it is a thing. It's not done properly. And it's one of the number one ways we prevent illnesses and the spread of illnesses and diseases. So think about that. Why is that? Like, what are we doing? And I know, like, even in hospitals, we have, because this is such a big deal and so time consuming, we had to put hand sanitizer outside the patient's room and also inside. Even in home care, I have my hand sanitizer with me. I have to constantly hand sanitize all the time. And the reason why I do it, not only because I was told I have to, I know these studies exist. I do not want to harm my patients. You do not want to harm your children in your classroom, ourselves. We don't want to get sick because there are some really nasty illnesses out there. Obviously, we're just looking at some of them that we can get that'll make us really sick. We work with high risk populations. So children under 5 years old are considered high risk. What does that mean? That means they are more susceptible to being hospitalized from dehydration and complications. So we want to keep everyone really safe. Then who knows who they have at home? They could have someone who's elderly, their health is compromised. We can do our part to do our best with our environment and washing our hands and putting on gloves proper way. So in this way, we can break that chain. So looking also at primary caregivers, they wash their hands about 30%, which is better. Paraprofessionals or aides, 11%, and parents, 4%. So that is an interesting statistic to me because I think about when I look at this, why is that? Is it because primary caregivers have more practice, more education? It's more part of their day to day. And then is it because aides need, more practice, more like they need more? And parents, what are we lacking with the parents that they are only at 4%? So then I relate this to, okay, we have meals coming in from these homes. And here I am, I'm putting on my gloves and I'm touching one child's meal. Who knows if the parents wash their hands when they're preparing it? Then I touch another child's meal with those same gloves and I'm touching their food, I'm taking their nuggets, I'm putting them on the plate, or I'm opening things and I'm touching things. And then I go and touch the next one. So keep that in mind that could be a source of cross contamination right there. So then after you touch all of those foods that have been all in different people's homes, that have been touched by all different people's family members, you're then taking those same gloves and then getting cups of water, touching the rims, putting it on the table. So just thinking about these things as you're going through your day to day are important. So just moving forwards, so we're looking at compared with children who stay at home, those who attend early child care centers are 2 to 3 times more likely to contract respiratory and gastrointestinal infections. Well, of course they are. The more children come together, the more chances there are of spreading any kind of illnesses or diseases. If you're home, it's more controlled. So, a lot of this is in the control of the classroom environment. How are we separating children from other children who are sick? Are we wiping those noses properly? Are we diapering properly? Are we sanitizing the way we're supposed to? So looking at the big picture. And I do like to say, like, how this links to even a bigger picture, and that's healthcare costs. Because if our kids are sick, teachers are sick, parents are sick, family members are sick, and these diseases are spreading, it's costing healthcare. It says $1 billion, but I feel like it's more than that. And then studies also show that successful hand washing can lower diarrhea by 72% and colds by 54%. That's huge to me, like absolutely huge. So again, all of the resources for these studies and all of these slides are linked at the end in the references. So this is a video that I pulled from Head Start, and I'm going to play it for you. It goes over disinfecting and cleaning and how that's, the safe infection control.
Hello, I'm Dr. Danette Glassy. I'll be your host for this episode of Keeping Them Safe. Today's topic is preventing infectious diseases through proper hand hygiene and cleaning techniques. It's important to note requirements for your programs vary greatly from state to state. Most states, territories, tribes, or local health departments may have different regulations, training requirements, forms, or other procedures in place. It is important to understand and follow your state or local regulations. As you may already know, infectious diseases can spread quickly in early care and education programs. There are 3 ways that germs spread. Droplets in the air. Think of that sick child who forgets to cover a cough or sneeze. That child's germs go into the air and other children might breathe them in. Droplets on surfaces. This is similar to the first example, except the child's cough or sneeze releases droplets that contaminate surfaces or people. Through direct and indirect contact. Direct contact is when a sick child touches another child. Indirect contact is when a sick child touches an object, such as a toy, and another child plays with the contaminated toy. This exposes the child to germs. Fortunately, there are ways to reduce the spread of infection. 2 important ways are through good hand hygiene and effective cleaning, sanitizing, and disinfecting practices. The information I'm about to share comes from Caring for Our Children, a collection of best practice standards for early care and education programs. The most common way to spread infection is through hands that are not cleaned well. Early care and education programs that consistently use good hand hygiene techniques report a drop in the spread of diseases. So what are proper hand hygiene techniques? Wash your hands with soap for the duration of the ABC song, or at least 20 seconds. Make sure the nails get cleaned as well, and then rinse with clean running water. Providers should assist or supervise young children in this practice. If it's not possible to use soap and water, for instance, if children are outside, the alternative is to use an alcohol-based hand sanitizer. Keep in mind that hand sanitizers don't kill all the germs that are common in childcare programs, such as norovirus germs that can cause diarrhea. When using hand sanitizers, it's important that visible dirt is cleaned off the hand and to make sure the hand sanitizer is rubbed in until the hands are dry. Caring for Our Children has a list of situations and times of day when providers and children need to thoroughly clean their hands. A second way of effectively reducing the spread of infectious diseases is the routine cleaning, sanitizing, and disinfecting of objects and surfaces in your program. Let's start with definitions. Cleaning involves using soap or detergent and water to remove dirt and germs from surfaces. It's important to clean food prep areas as well as tables, floors, and toys. This doesn't kill all germs, but it does reduce the number of germs. Sanitizing is one step up from cleaning. It reduces germs to safe levels as defined by public health standards. Programs should sanitize surfaces and objects that are used often, such as food prep areas, utensils, and toys. Disinfecting involves using chemical products to destroy germs. Items exposed to a lot of germs, such as diaper changing tables, doorknobs, drinking fountains, and bathrooms, should be disinfected after being cleaned. In Appendix K of Caring for Our Children, you can find a recommended schedule for the routine cleaning, sanitizing, and disinfecting of your settings. Two cautions when cleaning, sanitizing, and disinfecting. Always follow manufacturer's directions for use, including contact time and need for rinsing. And perform these tasks away from children. Make sure there's adequate ventilation and prevent children and staff from inhaling potentially toxic fumes. Children who have a respiratory condition are at a higher risk of problems associated with inhaling these fumes. The key to preventing infections is to have clear policies and procedures around hand hygiene and cleaning that staff understand and practice regularly. Best practices include consistently revisiting these policies and procedures with staff through observation and training. You may want to post clear hand hygiene and cleaning guidelines in your settings, specifically around areas that may have more germs like hand washing sinks, food prep areas, and your diaper changing tables. At the end of this episode, be sure to check out the online training, as well as resources for staff and families on the video page. Before we close, I have two reflective questions for you. First, what are some plans and policies you have in place for reducing the spread of germs in your program? And second, how do you ensure that staff are aware of and practicing ways to reduce the spread of germs routinely and consistently in your program? Thank you for spending this time with me. We'll see you on another episode of Keeping Them Safe. Remember, the more you learn, the safer they are.
Okay, so I thought that video was really well done. I think it kind of ties everything together of what we were talking about. Um, and I apologize if you hear my dog whining at the door. Um, but just some things to think about. I know she talked about, having policies, looking at our procedures, and just making sure those are really strong. And I think that that's a really good point. So, does your center have even a gloving policy? Like, I think this is something that would be sort of new. Not everyone I've seen has one. But I think it's good. I think it's good to talk about. I think it's good to practice. I think it's good to sign teachers off on. Does your center have a hand sanitizer policy and hand washing policy? So, hand sanitizers, not everyone uses them in their center, but when appropriate outside, like, a good policy will ensure that even outside, if they're, usually we have like the soap and water in our first aid bags, but maybe that is something, that's more appropriate for the children, and then the teachers have the hand sanitizer policy outside. So thinking about that and how to navigate that. Also assessing those diaper changing policies, toileting and meal times. How can we make that better? How can we improve that? What are some challenges? What are some things that need to be discussed with these topics to make it easier, to make it more sanitized, like more of a best practice, I guess is what I'm trying to say. So watching or observing, a meal time and saying, okay, like I can see it. This is, very stressful. Or good job with the table washing, good job with the hand washing. Maybe we need to work on a couple things, or having that discussion about what is stressful and what isn't really working, and how we can improve. And then looking at professional development. So, is the way the information is being delivered appropriate for everyone who needs to know it? For me, like I know going into school and then into my professional career, I have had to take tests on what is my best learning style. And that has really helped because I feel like over the years, they've changed how we have to do our professional development as nurses so that we can be engaged in different ways, listening, visual, hands on. And I think just, when we do our professional development, when we're doing the hands on piece, just like for CPR, are some of these things, is it important that we sign teachers off on it? So in this way we can have the discussion on what support needs to be next. And then how is this information shared with the staff and parents? Is information even going home to the parents? How can we get to all be on the same page? It's definitely a great conversation to have and things to look at, so we can just continuously every single year improve the way that we do things around safety and have healthy environments. So I feel like that's a goal we all want to have. And then here are the references. So, like I said, I kind of put this slide on there. So, if you want to look more into it, the Head Start safety practices, there's a lot of information there. So, definitely check out that site as well. I think they are a great resource for some of these things. I know they'll be adding some checklists. So, you can also use those that help with environmental safety and health. And again, thank you so much for your time today and just listening to this. And again, it's education. We're training our minds to think just a little bit differently. And I feel like now that you have this in your head, you're going to start looking at things differently. It's going to come more naturally. And again, like when we're doing observations, we have slip ups. It happens. But how do we decrease the slip ups? And I really feel strongly that it is with just education and practice. So please, everyone, have a wonderful day. You did a great job.